Hey, quick question. As a radiologist, are you more a visual person? If so, watch this episode on YouTube at Imaging Toronto. If you want to see the faces behind the voices in our beautiful studio in downtown Toronto, move over to YouTube. The link to our channel is in the show notes, and it's at Imaging Toronto. Welcome to Radiologist, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. Humankind has been through a lot of ages. We had the Stone Age, the Iron Age, the Industrial Age, the Dark Ages, and now we live in the glorious age of superhero movies. Speaking of superheroes, the quintessential superheroes are Superman and Supergirl. Incredibly strong, they can fly faster than the wind, have X-ray vision. But in addition to all of this, they both had family lives. And in their family, they were known as Clark Kent and Kara Danvers. And quite often we find that life in the family was more challenging for them when compared to their superhero lives. Their family life gave them the highest highs and lowest lows, and that's where life was very interesting for them. Now, speaking of superheroes with X-ray vision, we have with us today Dr. Elsie Nguyen. She's the Associate Professor of Cardiothoracic Imaging at University of Toronto. She's the Vice Chair of Support, Inclusion, Diversity, and Equity. She's also the Cardiothoracic Imaging Lead of University of Toronto. And that's her superhero side. In addition to that, she has a family. She's a mom. Welcome, Elsie. Glad to have you here.
Thank you so much. That was such a kind and generous introduction. It's a pleasure to be here.
All right, Elsie. I want to start off by asking the age-old question, which came first, the chicken or the egg? Which came first? Were you a radiologist first, or were you a mom first? And how did that shape your career?
Excellent question. I think there's never a great time to have children and start a family. There's always something in the way that holds you back. But I delayed my decision to have a family until I was actually voted in as a partner within our group. Because during medical school, I thought, well, we have no money to raise a child. I was in a long-term relationship at the time. We weren't yet married, and it was kind of early. And also the financial situation, as you know, it's tough. So then residency came by, and I just thought, the call schedule is just so grueling. It's so punishing at times. How do we raise a family as residents? And my husband's also a doctor. We were both we graduated medical school from U of T in the same year. It's not easy to have children during radiology residency, and he was doing his residency in family medicine. So then I delayed it until after my fellowships, because I did 2 fellowships, and I thought, well, we're traveling around. We don't know where we want to settle down. Probably not a good time to have kids. And then when I was hired at University Medical Imaging Toronto, I also thought, well, I'm not a partner yet. Maybe I should wait until I'm voted in as a partner so that I have some job security. So I delayed having children for 10 years, even though I was in a committed long-term relationship. So that's why I became radiologist first before becoming a mother. And
some would say you had a lot of fun in your relationship. You delayed it for 10 years, not having kids.
True. There was definitely some advantage. You can enjoy traveling, for example, on a whim and being a little bit more spontaneous. But there's a price to that delay, because I was 35 years old when I had my first child. And psychologically, I'm probably a little bit insecure about that. But when you go to your obstetrical appointments, you start being labeled AMA, and that's not against medical advice. That stands for Advanced maternal age. And being labeled AMA is hard. It's hard to take that. And it adds to the guilt. Oh, I delayed having children all this time. Am I going to pay for it? And the other thing with delaying having children is, as you probably know from family and friends who have gone through this, it doesn't always happen when you want it to happen. So I know lots of family and friends who have struggled to conceive and needed a lot of help. Thankfully, we didn't need help, but it didn't happen right away. And that is also incredibly anxiety provoking. Wondering, okay, what's wrong with me? Why is it not happening? And so anyway, yeah, it's like with most things in life, you make a choice and you live with it. So I chose to delay starting a family until I was established in our group, voted in as a partner so that I had some financial security, but the price I paid, multifold. I was older, more tired. Having kids in your late 30s and 40s is not the same as your 20s.
Could say you were wiser.
True. It was a logical decision based on data, no question. But it wasn't optimal in all areas.
Yeah.
My sister, in comparison, had children in her late 20s. And she bounced back, let's say, physiologically after having kids, whereas I didn't. I was carrying around baby fat and blaming that for my weight gain long after it was biologically, feasible to blame it on your children why you couldn't lose weight. So, yeah, that's definitely challenging. And the other thing is my mom also got older. In the 10 years that I waited, my mom also got older. So by the time I had kids, my mom wasn't as strong and physically healthy to help me. So, it's not just you getting older, it's your family who can potentially help you. So, if I could do it all again, to be perfectly honest, I probably wouldn't have waited so long. Because as we say, there isn't a perfect time. But from a biological perspective and the fact that you need family for help, and the fact that it gets harder as you're older to have a family, I just from, your reproductive fitness, I think for all those women out there who are, in medicine or other very demanding specialties, maybe give it careful thought.
Wow.
Give it careful thought.
Me being single, you've given me a lot to think about now.
Don't take things for granted.
Yeah, that is true. But I want to ask you, so you were a doctor first.
Yes.
And then you were a radiologist.
Yes.
And then finally you became a mom. And so when you were a doctor and then you were thinking of what residency to do, and you ended up taking radiology, and as you say, you were already in a long-term relationship, you knew you wanted to have kids at some point, were you at all worried about the negative connotation associated with radiology, radiation risk, in terms of choice of specialty?
To be perfectly honest, that's a great question, but it didn't enter my mind at the time. Like, what I enjoyed about radiology were multiple things, but the challenge, the fact that you had to know medicine, but also know technology and know how you could apply technology to image the human body, the innovation, the fact that it often involved cutting edge technology, that all excited me. I never once thought, actually, and it's making me reflect that why didn't I think about the impact of radiation and at some point I'd want to have kids and how that would affect me. I think I didn't think it through that carefully, and I didn't necessarily want at the time to be an interventional radiologist where I might be doing a lot of procedures requiring fluoroscopy and so forth. That wasn't my leaning at the time. I was more diagnostic in my interest. So I think probably that's why it didn't factor so much in my decision-making for careers. But for those women interested in interventional radiology and doing a lot of procedures, it is something to consider for sure.
Yeah, so I understand. It's despite radiation protection, radiation safety, and stuff like that, I think especially for women considering a career in interventional radiology where you work in a fluoroscopy suite all the time, despite data showing that it may not be harmful, it's always a more emotional decision. And I think it's a difficult choice to make at that point. But you had made a choice of entering radiology. So you were a radiologist, and then you're a mom, and now you're both a mom and a radiologist. Now, did this transition point of you being a mom, did it affect what sort of radiologist you were? Or was there a difference in what kind of radiologist you were before and after you were a mom?
Great questions. Wow, you're prompting me to do a lot of self-reflection.
Soul searching, yeah, that's what we do here.
That's right. Let's get into it. I think what you're getting at, if I understand your question correctly, how did motherhood change me as a radiologist?
Absolutely. Yeah.
And I would say, yes, for sure. It changed me and it helped me be a better radiologist, I would say. How? From communication. So the way I communicate with my children, I was reading loads of parenting books because I'm a very cerebral person. I like data. I need to be a thinker. I need to plan. That's the type of person I am. So I read many, many parenting books and I learned how to speak to children with respect so that you can influence their actions, but without breaking their spirit or being condescending or damaging to their self-esteem. So part of that is acknowledging and empathizing with what somebody might be going through. So instead of dismissing and denying a child's emotions, which I was doing before I read these books, when a child is hurt or upset about something you think is trivial, you'll say, don't worry about it. It's nothing. What's wrong with you? Why are you so upset? Like those kind of reactions from a parent, which are admittedly very natural, can be really devaluing to the child. So instead of dismiss and deny, I now empathize. Okay, why is my child feeling this way? So I say things instead like, that must have been really hurtful, what you just experienced. I can understand why you're angry about this. Can you tell me more about what you're feeling? And it may seem trivial, but when you're having a difficult conversation with a colleague, a trainee, having that empathy and understanding their perspective and why they might be feeling or thinking a certain way, I think does a great deal to open the lines of communication to let the other person know, I want to hear what you have to say. I understand, and I can appreciate your perspective. That gets the dialogue going and you don't shut people down. And they also respect you. So, there's mutual respect there. So it's helped me with my communication skills for sure as a mother because of all the parenting books I read.
That's amazing because when you started answering it as communication, I thought you were going to say, after learning how to talk with kids, I now know how to talk with clinicians. I thought that's what you're going to say. But yeah.
But that too, coming from a place of curiosity as well. So if you don't understand somebody's position and you immediately disagree, like that's a crazy idea. What a thing to say. Instead of saying those things, you can say, that's really interesting. I'm curious to learn more about why you think that.
Okay.
Or do you know what I mean? So for example, with a clinician colleague and they're making an unreasonable request in your mind, you can ask for more information. I'm curious to think why you feel a CT scan would be appropriate at this stage. Can you tell me more about the patient? And then you have a discussion and you say, well, actually, based on the clinical question you're focused on here, we don't need to do a CT scan. You know what I mean?
That's amazing.
You're having that discussion in a respectful way rather than, this is a stupid request. Don't bother me about it.
Absolutely.
More like, I'm curious to know why you think a CT scan is indicated here. And like, why do you think the CT scan will give you information that will guide your management? And then you force them to talk it through because actually sometimes they recognize, you know what, we have all the information we need.
I think you've dissected parenthood and you've turned it into a science. Someone actually once said that parenthood is like folding a fitted sheet. No one knows how to do it.
Well, you can do it.
Looks like there's one person who knows how to fold a fitted sheet.
I don't have all the answers. Don't let me mislead you at all. I don't.
Speaking of having all the answers, now your kids obviously should have asked you, what do you do, right? How do you explain to your kid, what do you do for work? That would be a challenging question to answer, especially as a radiologist, because I have trouble explaining even to adults exactly what we do. How do you explain it to a kid?
Such a great question. Well, thankfully, they see me work from home. The one benefit of the pandemic is we've been able to work from home. So 1 or 2 days a week, I can work from home so they can see me doing it. But I explain to them in simple terms that I'm a doctor who looks at pictures, and the pictures tell me what's going on with other people. I can see what's happening inside of them. And I tell other doctors what's going on. I tell the story of what's happening inside the body. So they're fascinated by that, that we can see inside the body with imaging. And they're
So your kids probably don't steal cookies. They know that if they steal cookies, you can see right through them and find it out.
Yes, I can actually see it on a CT scan. Yeah. So that's how I explain it, But it's a great question. In fact, there's a lot of misunderstanding in the lay public. What is a radiologist? We get confused with radiation oncologists, and we get confused with the technologists who are a valuable part of our team, but we are not technologists acquiring the images. That's a lot of, the misconception I hear,
So it's good that you teach your children who we are at a very early age so that they can help dispel a lot of misconceptions before they begin.
That's right. Yeah.
So often it's said that it takes a village to raise a child because it takes a lot of people, a lot of time and a lot of effort to raise a kid. But then again, so is radiology. It takes a lot of time to be a good radiologist, especially in an academic center, and especially with the 100,000 accolades you have and your positions you're in. So how do you find the balance now that you're a mom and a radiologist and you have more than one kid? So how do you find a way to balance both careers? One as being a mom and the other as being a radiologist.
Great question. I get asked about work-life balance a lot among the mentees that I mentor. You might not want to hear this, but I don't think there's such thing as perfect balance. And just like beauty is in the eye of the beholder, so is balance.
So you're saying what Thanos said, everything is perfectly balanced as it should be. That doesn't exist. I knew Thanos was lying.
I know. Stuff of movies. I wish we could snap our fingers.
And half the troubles go away.
Exactly. That's not how life works. So balance, to me, there's no perfect equation for everybody, and it's not a one size fits all, for sure. And as I said, balance is in the eye of the beholder. And to give you an example, we have early shifts, as you know. You have them in abdominal imaging as well. And I wake up at 4 a.m. I start reporting at 4:30 or 4:45 a.m. in order to complete my work. And I was explaining this to my 7-year-old son, and he looked at me with this, shock. And he said, "Don't your colleagues know you have a family? That is ridiculous to be waking up that early." But it's what we do, and it's part of my work expectation, but that's incredibly imbalanced in his eye. Through the lens of my 7-year-old boy, I am always working too much, and I am always not spending enough time with him. Do you see what I mean? So no matter what I do to achieve my so-called balance, there will always be somebody within my sphere who's seeing a lot of imbalance, right? So the way I see it, it's all choice and consequence. You make a choice and you deal with the consequence. There are times in my life where work is going to be a focus, like this week before the RSNA meeting, the Radiologic Society of North America meeting. There's lots of work-related things I need to take care of. But then after this conference, I'm going to be focused on my family. So the scale tips. It's constantly changing. It's not a fixed equation. I'm going to prioritize work certain times. And then when that task is done, it's now focus on the family. And I'm going to put pause on work. It's constantly shifting. It's a dynamic influx situation. Do you see what I mean? So there's no one balance. It's a dynamic, fluid, changing proportion equation.
Not gonna lie, that actually gave me goosebumps. It's a good allegory of life in which things are dynamic, things keep changing, and then there is this beauty and harmony and the balance it brings along.
Exactly.
That's absolutely
it's never
amazing
a static point in time and a one size fits all. And keep in mind, like with my 7-year-old, there's never balance for him because he always wants to spend more time with his mom. right?
That's amazing.
But
But
that's
wait
for
till
me.
they're 14, right?
Then the balance changes for him. You're spending too much time with me. I need to go spend time with my friends.
I guess that is balance in a way, right? It just everything is in a constant flux, and it's
Exactly. The proportion of time that my children want to spend with me is going to change over time.
change over time.
Yeah.
That's interesting.
Yeah.
In your dual roles as a mom and a radiologist, what other challenges did you have to face? And let's hypothetically say you were in control of making all changes. What changes do you think can be made to make things easy for people to be successful in both a good career as well as feel like they're contributing enough to their family and very engaged in their family life as well?
Great question. I think what would be really helpful if you're working in a corporation or a group like ours is to support families by having paid parental leave. That sends a message that we know you want to have a family. We know you already have a family. We support that as a group, and we will take care of our human resources or staffing to allow you to spend time with your family. I think that sends a really great message to employees and also creates a very positive culture and precedent that that's a good thing. We want you to be healthy and happy outside of work because that's how you contribute more when you are at work.
Absolutely.
And we are human beings that have lives outside of work. So that's one important thing. And also just general attitude. This is hard for me to say without sounding, I guess, sexist, but just realize that women of childbearing age can have a family and still be successful and still contribute. What I notice happening is there's an attitude that if you're a woman in particular with young children, you've got a lot on your plate. So let's not give you an opportunity because you need to deal with your family. So you're passed over for leadership opportunities. You're passed over for any kind of opportunity that might lead to career advancement because people see you as young mother. Let her focus on that. Let's ask this dude over here who's married to a stay-at-home mom and he has lots of time.
Yeah, that's the worst thing that people can do, right? They think they're actually helping you, where in fact, it has the opposite effect.
Exactly. And it's part of the culture and infrastructure that actually oppresses women. This bias that if you're a mother, and especially in the early years when your kids I have 3 kids. They're age 14, 11, 7 right now, for example.
You have 3 kids?
I have 3 kids.
Wow.
Mother of 3. I'm part of that group.
Because what I once heard about someone having 3 kids is that I heard somebody saying that I used to have 3 theories on parenthood and no kids. Now I have 3 kids and no theories.
They are all so different. That is true.
Exactly. So somebody was like, when you're 1 kid, you're a parent. When you have 2 kids, you're a referee. I can't even imagine what it is when you have 3 kids.
3 kids is playing hockey when you have nobody on goal. Like there's no goalie. Like it's do or die, and there's somebody unattended,
wow.
And you can get a goal scored because nobody's manning the net. So some child is unattended usually when you have 3 kids. The 3rd child raises himself or herself.
Oh, well. We did it once. We did it twice. Not doing it the 3rd time. You can grow up however you want to.
That's right. But our 3rd child is very independent.
That's great as well. And yes. Sometimes they're a little bit spoiled, but yeah.
He's very, let's say, precocious because he has 2 siblings who teach him things.
Yep.
Like he's got constant role modeling, I guess, of things he shouldn't be learning sometimes, but yeah, he can be advanced for his years. Yeah.
That is amazing. And among all of this chaos in which trying to man the net with 3 kids and all your academic achievements, how do you find time for yourself?
Oh, this is such an important question. Self-care, critical, because it's like being on an airplane. You got to put your oxygen mask on first before you can help somebody else. So self-care allows you to be there, present and healthy to take care of your family. So after 11 years of working full time, I realized I am not healthy and I'm not doing a great job at work or at home. So I decided to ask our chief, Dr. Heidi Schmidt, for the ability to work part-time. So I went from 5 days a week, 100% full-time equivalent to 80%.
Okay.
And I work 4 days a week, which has changed my life in great ways. So my day off is me time. That's when I go exercise. I go meet a friend for lunch. I get my hair cut, whatever I need to do to feel good about myself so that I can take care of my family. That's my day off. And not everybody can do that. You know, there is a financial cost to that, but I think there's more to life than money.
Yep.
I can always make more money if I want to, but there are more important things in life, and that's not what brings me happiness ultimately. So consider that. Work a little bit less so that you can take care of yourself and feel, you know, happier in general.
That is amazing, because ultimately it is a balance with many components: career, family life, and then care for the self. And it's finding out what proportion you need in each to keep yourself truly happy.
Exactly.
That is amazing advice. But so you gave one great advice that make sure that you have your oxygen mask first, and then, you know, choose your most favorite kid and then the other kids. But what other advice would you give to a younger you, someone who's aspiring to be you, who's looking up to be you, but is just starting off, either a medical student or a resident who's just stepped into radiology? What advice would you give, or what advice do you wish somebody had given to you when you started off?
Oh, that's a great question as well, and such an important one. I think my first piece of advice would be relating to happiness and what makes you happy is find joy and meaning in your work, because that is the work that you should focus on. Because let's be honest, time and energy are limited resources. You know, we don't have all the time in the world. We don't have all the energy in the world to devote to everything we want to do. You have to be selective. So prioritize and nurture. Focus on the activities at work or in your personal life that bring you personal joy, that fill your bucket, and that, you know, give meaning to your life. That's where you're going to find happiness, and that's where you're going to maintain this positive mindset, which is important for building resilience. So life is hard. You were mentioning it takes a village to raise a child. It takes a village to get through life. So if you can stay happy, positive, build resilience, you can handle almost everything that comes your way that's traumatic or challenging. So number one, find joy and meaning in your work life and your personal life. Second piece of advice, be organized. I am constantly working on something. When I'm driving home, I'm on the phone, touching base with my father. I'm planning out the week. I'm thinking, what do I have to do tomorrow? No time is wasted in this brain. Like you know, the old saying, women are multitaskers. You have to multitask if you want to accomplish things in a short amount of time. So when I'm in the shower and doing mundane things like grocery shopping, I'm thinking, okay, how do I rework that paragraph in this paper I don't like?
Wow.
My brain is going.
Yeah.
Maybe that's not the best advice and it doesn't work for everybody.
When I'm in the shower, I'm just like, my brain is like in a fantasy land. It's like, what would happen if Spider-Man was in a Superman movie or something weird like that?
Those are important questions to ponder.
True, yeah.
But I'm just thinking, if there's downtime, you're waiting in line for something, maybe think about something you have to do and how can you do it without doing it too much so that you don't have downtime. I know that's a crazy thing to say, but I try to be efficient. Let's say that. Organized and efficient. Third piece of advice, and this is perhaps pertaining to you, if you're not already in a relationship, find someone who's going to be supportive of your career goals, if you have any. But you want somebody supportive who understands this is an important part of you and to help you achieve your goals.
Who understands what proportion you need in each of these buckets to make you happy. And if they are understanding of that, and if they don't criticize that, hey, why do you spend so much time with kids or with work or with personally, then that would be a problem. So I guess like your partner should be understanding of.
Exactly. Ideally, if you're on the same page.
Yeah.
Yeah.
So Elsie, I've been saving the best question for the last. So you're a doctor, you're a radiologist, but you have touch with almost every other specialty. So you are in touch with cardiologists, with pulmonologists, and you've established an excellent collaboration through the university, through the hospital, that you know what the daily life of almost every single specialty is going to be. That said, for women, for young mothers, for mothers-to-be, would you still recommend radiology, or what do you think in your mind would be the best choice after med school?
Absolutely. If I could do it all over again, I would 100% choose radiology. And I think it's a fantastic specialty for women. For example, as I mentioned, I have the ability to work part-time. That's not easily achievable among other medical specialties. And I am able to work from home 1 or 2 days a week. That's amazing for me because I can do the drop-off pickup of my kids. I can attend, a performance at their school and then finish my work later. There's that flexibility that is so important in radiology and very supportive of family life. And also in radiology, and I thank my colleagues who supported me in this, I have 3 children, as I mentioned. I was able to take 6 months off for my maternity leave for each of my 3 kids. And that's not easy when you have your own patients. You have to hire a locum, who's going to do the on-calls and take care of your patients for urgent situations. Not easy in other medical specialties, but I was able to take that time with my children. So 100% unequivocally, it is a fantastic specialty for women and families, not just women, but very supportive of family life. To be a radiologist and a mom, it is more than doable. It is actually enjoyable.
That's absolutely amazing. You know what they say, that not all superheroes wear capes. Some wear aprons and carry diaper bags. And you heard from Elsie Nguyen, who's an amazing radiologist. She has established herself in multiple leadership roles, in multiple innovative areas. She's the vice chair for Equity, Diversity, Inclusion and Support of the University of Toronto. And as an incredible radiologist, she's always there to save the day, just like any other superhero would. But what she's more proud of is to shape the life. Superheroes can save the day, but mothers shape an entire life. And for all moms out there, or women planning to be moms out there, in her own words, radiology is one of the best specialties that you can choose. So welcome to radiology. Ladies and gentlemen, that was Dr. Elsie Nguyen, Vice Chair of Support, Inclusion, Diversity and Equity, Cardiothoracic Imaging Lead, Associate Professor at the University of Toronto, and me, your host, Satish Krishna. See you on the next one. You were listening to Radiologist, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media at Imaging Toronto.